Views and opinions expressed may not reflect those of the Allen County Public Library, Access Fort Wayne, and or any other supporting groups. If you are interested in producing your own programs for Access Fort Wayne, you can contact us at 260-421-1250.
Welcome to Countyline. Hi everyone, I'm Mike Green, Public Information Officer in the Allen County Commissioner's Office, and welcome to Countyline, the program that features news and information about county government. And we have a follow-up story to begin this episode of Countyline, and it deals with the Stonebridge Business Park located on the southwest side of Allen County. It was about a year ago that we were out on this 124-acre site as earth was being turned. But now this $6.3 million project is ready for businesses to start moving in. It's a shovel-ready site. And on August 26th, the special dedication ceremony and ribbon cutting was held, and we were here for some of that.
Good morning, everybody. My name is Mark Becker. I'm with Greater Fort Wayne, Inc., and I just want to take first the opportunity to welcome everyone to this exciting event this morning. One of our key goals in economic development is to have quality product available to serve the needs of companies that are here in our community who are looking to expand, as well as companies that are looking to locate new facilities in our region. And Stonebridge Business Park is an excellent example of a lot of hard work to put quality product in place. This is a 124-acre industrial park that's shovel-ready, which means that it's got water and sewer and roads, gas, electric, communications, zoning in place, etc. The goal of which is to ensure that there isn't any risk for a company looking to locate here. No risk obviously translates to no delays and no extra costs in a project. And so we want to particularly thank the Allen County Commissioners, the Allen County Council members, and the Allen County Redevelopment Commission. And I saw Mark Royce here as well, Mark and the staff, for all the work that all of you have done to accomplish this vision. I worked for a previous mayor who always said that great things happen when opportunity meets preparation. And that's what this is all about, to prepare this community for great opportunities that are going to present themselves, and we're ready to respond and respond quickly. And so with that, I'd like to introduce three speakers who are going to also make some comments this morning. First is Therese Brown, County Commissioner. Therese?
Good morning and welcome to probably the hottest day of the summer. Good day to wear a jacket. Welcome everyone, and Mark, thank you for the introduction. And this has been, it seems like a long road to get here, but actually it was a very short time frame. And I want to thank my cohorts, Linda Bloom and Nelson Peters, as well as the Allen County Redevelopment Commission, Mark Royce, absolutely, and Allen County Council specifically, Tom Harris and Darren Vogt. The confidence that they had in this process, bar none, was extraordinary. We needed to have a shovel-ready, true shovel-ready site available for anyone who may want to locate here. And coming off of a recession the way we did, and knowing that we needed to step up, and in a very short period of time, we were able to do so. So at this point, it was actually a philosophical change for the county to actually drive money into the process, to actually put the concrete down and get the infrastructure in and get all of the players through the permitting process and everything taken care of, so that any one of you or anyone that has the opportunity to locate here can jump over some of these barriers and be able to set up business and locate here in this business park. It was a total team effort. It was not only county departments, it was, as I said, the Redevelopment Commission, the County Council, City Utilities, the surveyor, appraisers, and a plethora of individuals, and even our neighbors across the street who've been very helpful to us in driving this as well. A learning curve was learned. if you will. We found out what the hurdles were, and we were able to meet those challenges. You know, $6.5 million has been invested in this process, and not only the land but infrastructure. And for that, it's amazing how quickly we could turn this around. And on that note, I want to thank again everyone for being here today, and hopefully we will have a great success in a very short period of time. And I will now turn it over to Rich Beck, President of the Allen County Redevelopment Commission.
Thank you, Therese, and thank all of you for taking time out of your busy schedules to join us this morning. This is an exciting time for Allen County, and especially the Redevelopment Commission, as we've taken on a little bit different tasks than historically what's taken place. I want to go over some of the attributes about the park and let you know exactly what we have to offer. All the infrastructure is in place: water, sanitation, sewer, regional storm sewer, concrete streets, street lights, power's on the way, as well as the telecommunications. The storm sewer, as we complete the speaking part of this, I would hope that anyone takes a drive through the area and you take a look at the storm sewer system. Someone once said it could probably take care of northeastern Indiana. It's quite an advantage back there, because what that does is it allows all of these lots to tie into one storm sewer instead of each lot having to come up with their own storm sewer and drainage system. So that, we think, is a huge advantage. Obviously, we sit right across the road from General Motors, a great neighbor. We're next to Vera Bradley, One Resource Group, and soon to be adjacent to Group Delphi, our newest neighbors, and those folks. So we think it's a great location. Two major interstates, I-69 and I-469, and the widening of Lafayette Center Road, which was approved this first quarter of 2014, to a four-lane highway, or four-lane road, I should say, between Fort Wayne and Roanoke. So we think that's a great adjunct. As stated already by Commissioner Brown, the genesis of this project was really land banking, and the county commissioners, county council, and redevelopment commission initiated that about 4 years ago. This is just one of several properties that the redevelopment commission owns for the sole purpose of economic development. Government cannot create jobs. Government can only create an environment conducive for the private sector to create the jobs. We've done that with Stonebridge Business Park. It's important to note also that the Redevelopment Commission members take their fiduciary responsibility of spending taxpayer dollars very seriously. After all, we're taxpayers as well. We're not in this to make money, but we're not in to lose money either. There's so many people that were involved, as Commissioner Brown indicated, in the success of this project. Many of you are here today. I want to thank all of you for doing your share to make this project so successful. I'd like to mention every one of you by name, but I'm certain I'd miss someone, and I don't want to take that chance. So thank you all to the team that made this happen. The first success is the completion of the project. The total success will be when businesses move in, build buildings, hire employees. That's when we really celebrate. And thank you all for being here. Now I'd like to introduce Representative Casey Cox. He's had some comments as well. Casey?
Thank you, Rich. My name is Casey Cox. I'm state representative for the 85th district. I want to thank the three of you because my district's out on the east side of the county. I didn't realize it came all the way down here. Who knew? No, actually, one of the reasons that Rich asked me to share some very brief comments is that in my real job, I actually played a very small role in this project in my work with County Attorney Bill Fishering in my practice of law with the law firm of Beers, Mallers, Bax, and Salem. So I got to see this project not only as a state legislator, but in my private practice as well. And I just want to very briefly comment on some of my observations. I think everyone here has mentioned it, but I think Allen County is a special place with regard to economic development because so many people here reflecting so many different levels of economic development organizations or levels of government. We have people from the city of Fort Wayne, people from county government. We have a project coming in on Lafayette Center Road where we'll be working with the Huntington County Commissioners and Huntington County Council. It's a reminder that with regard to economic development in our region, none of us live on an island, and I think we have so many examples of successes of collaboration in this county, and I think this is just another feather in the cap, another example of how collaborative we are here in Allen County. And so my thanks for letting me be a part of this today. My thanks for coming, and look forward to cutting the ribbon. Thank you.
Okay, I think everyone is going to, I'm getting the signal to go that way, and we'll have the ribbon cutting, and of course there'll be representatives to answer any questions the media has. Thanks.
Prescription drug abuse is becoming quite an epidemic, not only throughout the country, but here in Indiana as well. And there really isn't a segment of society that is not being affected by this. More and more we're hearing heartbreaking stories from people who are suffering from dependence and abuse of prescription medication. The problem has come to the point that now here in Indiana, a task force has been formed to try to address the issue, both in terms of the medical community and the public at large. Dr. Deborah McMahon is the health commissioner here in Allen County, and Dr. Dan Roth is with Summit Pain Management, and both of these individuals serve on this statewide task force. We're going to talk to them about the problem itself and also what the task force is doing to try and reduce the epidemic here in Indiana. And first of all, Dr. McMahon has kind of mentioned the outset. You think about asking you who is affected by this, and maybe the easier question is who isn't affected by this?
Right. I think that it's just a huge problem. The CDC, the Centers for Disease Control and Prevention, really announced this as a huge problem probably about 4 years ago when they started noticing that accidental overdose deaths from prescription drugs was now equal or surpassing those deaths from motor vehicle accidents, and really called us to really address this issue and from both a public health perspective but also a medical perspective. And sad to say, but last year in Allen County, we too met that criteria where now we have as many deaths from accidental drug overdose as we do from motor vehicle accidents.
What are the numbers like, and what is the trend that we're seeing?
Well, unfortunately, Indiana is number 9th in the country in terms of prescribing narcotics and other opiates and anti-anxiety medications and those sorts of things. But we had a 55% increase in accidental overdose deaths from 2008 to 2013 here in Allen County. So we are also affected by this problem.
And Dr. Roth, I guess people are thinking, well, the doctor has written me this prescription. I mean, doesn't that make it safe automatically?
Right, and that's one of the problems that we face every day is a patient expectation of here's a pill, take this, it's going to take care of your pain. And unfortunately, over the last 10 or 15 years, I think we've missed the mark in patient communication as physicians, explaining to them what their problems are, giving them the other myriad of treatments to help them with their pain that are not opioid-based, and then going along with that, appropriate patient selection and monitoring for these medications. And that's part of what Dr. McMahon and I, being involved in the task force, are doing, creating a set of rules and regulations for physicians, along with the Medical Licensing Board, to help control this and treat it more appropriately.
Are there particular drugs that are being abused, particular kinds of drugs?
Absolutely. So when you look at different classes of medications that are involved with this, you're looking at opioid-containing medications, so normal things that you would hear about, things like Vicodin and Percocet, and of course those go into more extended-release medications like OxyContin and other medications that we all know about and hear about. But interestingly, too, other medications that involve the central nervous system in terms of how they affect a patient, specifically with respiratory depression, things like anti-anxiety medicines like benzodiazepines, Xanax, things like that. And then, of course, you start looking at other things like alcohol when patients ingest those. So a lot of times you put all these things together, and that's where you're getting the problem with the overdose deaths.
Well, I guess then the next reasonable question people would say is, well, if painkillers are that dangerous, why are doctors prescribing them? And there is an effort underway, I guess you could say, to kind of move away from that. Tell us a little bit about that.
Well, I think the problem really started a decade or so ago when there was a report published by the Journal of the American Medical Association where they really reported that doctors were underprescribing for patients with terminal pain. And I think that really started this whole new focus on pain as the fifth vital sign, that we were charged with addressing pain in patients no matter how they presented, terminal, non-terminal, if they had a sore throat. When you go go into the hospital, you're asked what your level of pain is, no matter what you're there for. And I think and then that coincided with the fact that we had an abundance of pain medications that were suddenly available. And I think that we became rather robust in our prescribing of these medications. And we've also created a society where people think they're supposed to be asymptomatic, that with a mere prescription pad and a pen, I can help you not feel the pain. And so unfortunately, I think this all just came together between patient expectations and our requirement really to make sure that pain is addressed adequately or maybe sometimes exuberantly, that I think we created the perfect storm for this addiction. I think that really coincides with, though, what we're seeing from the mental health perspective is that people are depressed. 60% of pain patients have underlying depression or anxiety. So when you combine these with these medications that sort of have an unintended benefit of helping with that, creating sort of a euphoria, you're really creating the perfect storm for unintentional addiction to actually occur.
And these are situations, kind of as you talked about, that come out of best intentions. You're trying to help the person with the pain. And is there a difference in the problem between addiction and abuse, or does one kind of lead to the other?
Well, and I think Dr. Roth sees this very often in his clinic. I think what happens as an intern, it's not a pain specialist, I think what happens is that it's unintentional, that people start using things for the right reasons, and then because it may be addressing some other really unidentified need for that patient, abuse can happen. But I think he's a better...
Right. Or let's face it, one pill is easing the pain off some, 2 or 3 maybe makes it even better, and before you know it, you get in a situation where you're taking more and more, and as we say, the addiction turns into abuse.
Right, and so what you're referring to is a self-medicating component, and what happens, as Dr. McMahon alluded to, is this: a patient will come in, will have a pain issue, some pain generator, and these things can vary. They can be very different. A lot of what we see on a daily basis, and the number one thing a patient goes to a physician for, is musculoskeletal pain, back pain, neck pain, headaches, things like that. And so what happens is a patient comes in with an expectation of, I'm going to the doctor, I expect to get something to treat me then and there on the spot. And that's one of the problems with, I think, our society in general, is we all want what we need now, and we don't sometimes want to do the extra work for it. And so what we try to do to address this appropriately is figure out what the pain generator is, try to treat that from an interventional standpoint, use things like concomitant physical therapy and behavioral management, do the risk stratification. And if somebody is high risk, when you look at them from the physician side, automatically, you're starting to pull up these red flags that, hey, they're not a candidate for an opioid medication, and let's start looking at the myriad of other options or other ways to treat them, and we do that with all of our patients, but doing the risk stratification gives you an idea of where somebody may end up as well. In terms of the addiction, it's important, I think, to know the difference between dependence, misuse, and addiction. So dependence would be someone who is on an opioid pain medication and they take it responsibly. They're on the medication, but they basically require that medicine to function. And that's an important thing, too, in terms of understanding function, because that's really our biggest end mark for our outcomes is how well does the patient function. Abuse comes when they start to aberrantly misuse, use the medication for euphoria, things like that. And those red flags usually are a patient calls with lost prescriptions, stolen prescriptions, they're out of their medication a week early, and you see all these things that go into that. So I think the key is in making this paradigm shift from the pendulum being on the end of overprescribing, treating a patient right then and there, taking care of their pain, is coming back the other direction, looking at why do they have the pain, how can we treat that pain from a interventional standpoint, get the patient actively involved, how can we improve their function, and how can we get them less reliant upon these opioid medications and therefore decrease the risk for addiction, abuse, and those types of things.
What are some of the signs if you suspect someone may be abusing prescription drugs? What are some of the signs that will help you kind of identify that problem?
So initially, when we first see a patient, some of the very first things we do are pull what's called in Indiana the inspect. It shows us what a patient's controlled substance prescribing has been for the past year. And a lot of times just doing that, you can find someone who's doctor shopping and filling multiple prescriptions, multiple pharmacies. We always check for their urine and see what's actually in their urine when they come to us the first time before we prescribe. when you're sitting there talking to a patient, a lot of times, even before I get into a physical examination, they'll already have told me what they want, and they're there, and that's the only thing that works for them. So a patient requesting a medication by name is another thing that can increase your thoughts that, hey, this may be a red flag. And then, of course, you go to do a physical exam on a patient, and a lot of times they'll over-exaggerate their pain. They'll over-emphasize different components of your physical exam. There's another red flag. And that's just on the first visit. And then you start monitoring them, the first few visits. You can really get a good idea pretty quickly on where you're at with that.
And this isn't a problem which just affects the individual who's abusing. This is really a problem that affects society in general in several different ways.
Oh, exactly. I think one of the most concerning things for me is to see the trend with our young people really abusing these kind of medications. And it was interesting when we looked at our overdose study, the Department of Health, the Coroner's Office, and the Fort Wayne Medical Education Program partnered to do this study. And when we looked at the results, what we found was that young people actually overdosed on anti-anxiety medications like Dr. Roth was talking about Xanax, but older folks overdosed on opiates. And what's really concerning is when, again, you look at the fact that young people are so anxious, when you look at the anxiety, the generalized anxiety disorder diagnosed in young people, that's why they're attracted to these medications. They don't realize the risks. They believe, as you said earlier, people believe because they're a prescription drug that they're safe. They don't realize that when I'm prescribing them, I'm looking at a whole lot of things other than your anxiety or your pain. I'm looking at your underlying risk factors for having an adverse outcome when I'm prescribing them. So when you're taking someone else's medications, they're not designed for you. They're not dosed for you. That's one of the biggest problems I see with our young people, because what we're seeing the pattern is statewide is that kids are going from narcotics and anti-anxiety medications. Now they're going to heroin because it's cheaper. There's been a significant increase in heroin use in the 18 to 25-year-old population.
Those prescription drugs are called controlled substances for a reason.
Exactly.
Well, let's talk a little bit about the task force that was formed recently that both of you sat on. Explain a little bit about how that was formed and some of the goals and objectives.
Well, I think the Attorney General's office was very wise in looking at this as a looming problem. And so a few years ago, they organized a task force that really looked at different aspects of this issue. Dr. Roth and I are involved in the education subcommittee. And what we did for our first effort was to really design a toolkit to really help prescribers, physicians, nurse practitioners, dentists, other folks who prescribe these medications understand the problem in the light of the 21st century, not only in terms of recommendations that we've learned now to minimize the risk of abuse or adverse outcomes, but also, as Dr. Roth was talking about, there are so many more opportunities now that have been studied that can impact pain that don't require an opiate, and to really sort of bring everybody into sort of a practice that really minimizes the risk of adverse outcomes, unintentional addiction, and really just an increased available supply of these medications in our communities.
Well, Dr. Roth, from the medical community standpoint, what kind of things is this task force recommending?
Absolutely. So when the task force was put together, charged with coming up with some recommendations for things that then went to the medical licensing board, who made the decisions about putting into place a certain number of rules or guidelines for physicians to follow when they're prescribing these medications. And so essentially, as you can imagine, one of the most important initial things is make sure you know your patient. You've done a thorough history, thorough physical examination. You've obtained medical records. So those are all components. Another component, which again is kind of a common sense thing, but wasn't happening as much as it should over the years, is risk stratification. So looking at tools that are standardized, validated, widely accepted by different organizations that can assess risk for abuse of opioids, what their depression risk is, risk for alcohol abuse. Those components go into that history physical exam as well. Then another component is to check our statewide system called the Inspect to see where patients are filling medications. Are they filling medications from multiple providers, things like that. Perform a urine drug monitoring. So that's a very, very crucial tool, because if I prescribe a patient a medication and I'm not checking to see if they're actually taking the medication I'm prescribing, I have nothing to go off of other than their word. And unfortunately, as we discussed prior to even talking about this, an addicted patient, you can't really take their word, because they're going to tell you whatever they can tell you to get what they feel like they need and can abuse. So that component gives you an objective idea of what a patient's taking, and then as you follow it down, in general, for the general medical community, keeping the medication at a certain level, at a certain dosage. And once you get past that dosage, really sitting down, if you have a patient who is low risk, you've done everything, they're a good candidate, they've got problems, let's say they've had failed back surgeries, things like that, or myriad of other issues, and the opiate medication is something you decide to prescribe to them, you really got to stay on top of it, take an objective look at, are they improving not only in their pain score but functionally. And that's one of the biggest issues that we're really trying to get the medical community to jump a hold of and understand and take hold of is, how is your patient's function? They can tell you their pain score went from a 10 to a 5, but what are they doing every day? Are they actually completing their activities? And so that's kind of a general overview of what the task force and medical licensing board put into place at this point. And then from here, we're really looking at what can we do to educate the medical community, make sure, like Dr. McMahon talked about, the toolkit, and make sure they understand what the rules are, how to use them, how to help the patient, and when to refer and not to refer, and really take a strong hold back in terms of appropriately managing the patient.
Well, obviously the medical community is on board with this, but for those of us just in the general population, what do we need to know, and what do we need to be doing to try and reduce this problem?
Well, I think this is really a good opportunity for us all to sort of reset our expectations and again move from this asymptomatic model to one of what do I need to do to be able to be functional in life, to have a quality of life, to be productive and able to do the things that are meaningful to me and my family. And unfortunately, that requires a lot of work and participation from the patient as well. Again, I can make you asymptomatic with a prescription pad and a pen, but you have to participate in making you healthy and well. And so I think it really requires all of us. This is a big shift, and we really understood this is a paradigm shift for the population, for the patients, and the providers, because again, this takes real relationship, discussion, trying different things, and all of that takes time, and most people feel like, whether you're a patient or a provider, you feel like you don't have the time. So it's really sort of changing and shifting our expectations. I think that's what, and the other thing is we have to be in tune with ourselves and our children. I think that the fact that we're perhaps missing some of these red flags that kids are sending out, that they're getting overwhelmed, they're getting stressed, that life is becoming a little bit too complex for them. I think we need to do a better job of really trying to be able to understand that, and then getting them into the right place to be able to address this, so that they're learning coping skills, they're not coping through pharmaceuticals.
If people want more information on the problem with abusing prescription drugs, what kind of resources are out there available?
Well, I think the two best resources are the CDC. Just go to their website, and they've got some wonderful materials for both the health care professionals as well as the general public. But our own website in our state is just very well developed. It's bitterpill.in.gov, and you can get a lot of information, again, both for providers but also for the general public as well.
Well, Dr. Deb McMahon and Dr. Dan Roth, thanks for being with us today. We appreciate it, and it's a problem we're recognizing here in Indiana and in Allen County, and steps are being taken to try and reduce this. And hopefully, if you have an interest in this or a concern about someone you know that's having this problem, you'll check out the resources. bitterpill.in.gov is the website to go to check that out. You can also check the Fort Wayne Allen County Health Department's website, because they have resources as well to help us address and attack this problem. And that will do it for this edition of County Line. Remember, all of our County Line programs can be seen online, either on our YouTube channel or video on demand service. And you can reach those two sites by going to our website, www.allencounty.us. I'm Mike Green, Public Information Officer in the Allen County Commissioner's Office. Thanks for watching, and we'll see you again next time on County Line.